Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning. Good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. And today we're going to be talking about health, specifically for women. So men, don't run away because you all have women in your lives. And so you need to be paying attention to this too. But I am a firm believer that it does not matter how successful our business is, what we're doing, planning for it, all of those various things, if we ourselves are not healthy. And so please join me in welcoming Dr. Manna Semby to our program today. Welcome, Dr. Semby. How are you?
I'm doing well, and thank you for having me here.
Great. Well, let me tell people a little bit about you, and then we will jump into this. So Manna Semby is a naturopathic and functional medicine doctor, specializing in menopause care and dementia prevention. Her first career was in finance on Wall Street. When her children were very young, significant family health challenges led her to switch careers and go back to grad school to obtain a doctorate in naturopathic medicine. She has two very audacious goals. The first is to help prevent dementia, and the second is to redefine menopause as a metamorphosis. She does this by educating women and men on the latest research and providing compassionate medical care in both areas. She is the founder of Aruna Med. So again, Dr. Semby, welcome.
Thank you. Thank you. Delighted to be here.
I love it. Well, I always like to know from my guests how it is that they got to where they are today. And we talked just briefly about that, but really tell us how it is that you have discovered that this is truly your passion in life.
Okay, so I have to go back a little bit.
Okay, we'll go back in the Wayback Machine, right?
Sure, yes. So I came to the United States in 95 and as a transfer student, and my career counselor advised that I should study accounting because as an accountant, I will always have a job.
Right.
So I did that. Mm-hmm. I became a CPA. I worked on Wall Street for a whole number of years. Mm-hmm. And it was okay. I was reasonably good at it, but it wasn't something that I was very passionate about. Mm-hmm. And then when my children were born, they were both diagnosed with autism at a pretty young age.
Okay.
And then the conventional medicine doctors, whom I used to really revere, they told me that there was nothing they could do for my children. Mm-hmm. And no mother wants to hear that.
Right.
And I started to do some research into what might have answers for me and my family. Mm-hmm. And then that's what led me down the path of alternative and complementary medicine. I decided to go back to school and study naturopathic medicine. And then I graduated. And I just found that, one, this was my place, like this was my community, this is my people, they talk my language. There is always something we can do. It's never the case that there is no hope. There's always something we can do, something that can help. And then once after I graduated, I knew, because of my experience with neurological conditions such as autism, that had a draw for me. So I started to focus on neurological conditions, but not autism. I decided to go to the other end of life, which is dementia. And then I trained in a program created by Dr. Dale Bredesen, who's a neurologist, and he has created a protocol to reverse Alzheimer's disease, which is, again, a very big goal. He has conducted a proof of concept trial where he showed that 84% of people that were enrolled in the trial were able to reverse symptoms of Alzheimer's. So I certified in that program, and then I worked with many patients with Alzheimer's and also that were concerned about the risk of Alzheimer's. So I saw that if people were not too far advanced into this disease, it was possible for us to make some changes.
Right.
So I was but the more I worked with this population, the more I became more and more passionate about preventing dementia instead of reversing Alzheimer's or dementia once it's already taken hold. Because there is so much we can do to prevent it, and the world doesn't know this, and we need to raise this awareness that dementia is preventable.
Right.
So that's one thing. And then while I was doing this work, I was diagnosed with breast cancer, and I was also menopausal at this time. So I had started taking hormone replacement therapy because I was educated about the benefits of this for women. And but during my cancer journey, my surgeon, my oncologist, all doctors, they were very unhappy that I was taking hormones because they kept saying, you have breast cancer, you should be off it. And I saw how well-meaning doctors can be misinformed or not be up to date with the research that has shown that, especially for women with hormone negative cancer, HRT is not harmful. And in fact, we know that women that take hormones at menopause, they have a 23% lesser chance of developing breast cancer.
Ooh.
And if they do develop breast cancer, then there is a better prognosis, better by 40%, that they will have a good prognosis. So there is a lot of misinformation in this field, and that just made me so it just made me want to do this work to raise awareness, to educate women as to what can help them, especially at midlife, because we have so much going on at midlife, right? We have our careers, we have our relationships, we have our children, we have our parents, we might be caretaking for them. So there is so much that is going on. And a lot of women experience burnout at this time, right?
And we don't take care of ourselves.
We do not prioritize ourselves. And we think that because we have so much going on, we are fatigued and tired and we're not getting enough sleep and we're anxious and irritable and depressed. Well,
that's normal.
Exactly. All of these symptoms are related to perimenopause and menopause.
Right.
The problem is nobody tells us that. Nobody educates women on what to expect once they get into their 40s and 50s. What are the symptoms of perimenopause and menopause, and how to manage them, how to take care of them, so that it is not that by taking care of our menopausal symptoms, life becomes easier, but we become more resilient.
Right. Right.
We become more resilient, and we can take care of our children, our spouses, ourselves, our parents, our careers, our businesses. Everything becomes easy once again.
Right.
You know, I talk to so many women who say that as they get in their 40s and their mid 40s, things become harder. You know, they just don't have as much patience. They're irritable.
Right.
They have mood swings. They have body composition changes. They're gaining weight in all the wrong places. So there's a lot that we can do, but first we have to educate ourselves.
Right. Right.
That's what brought me here.
I love it. You know, and to me, education is what is key. People who have listened to the program before know that I am a cancer warrior also. And it's funny, I like to say warrior as opposed to survivor, because we're in a battle, right? You know, but long ago, more than 30 years ago, I worked for the American Cancer Society, and I also worked for an oncologist, a fabulous oncologist who 35-ish years ago was way ahead of his time. But through both of those, one of the things that I really learned, even 35 years ago, was we had to educate ourselves. Of course, that was long before Google, and the internet and all of these things. And so the people that I talk with now, I tell them, you absolutely have to educate yourself, and don't do it with Dr. Google. That's, you type in something like cancer in your internet, it goes because there's just so much information. But it's, you need to find what works best for you. And more importantly, you need to find those who are going to treat you the way you want and deserve to be treated. And And I mean, I fired doctors. I fired several doctors. They were good doctors. They just weren't the best doctor for me. But it is about finding what is going to work, because for some, well, the treatments have obviously changed a lot, right? It used to be that it was surgery, massive chemo, and maybe you lived. I mean, that was kind of it. And now, of course, things have evolved, and that's been what is nice is it has evolved, and many doctors and care providers are seeing that we have to have the combinations, not just what is good nutritionally for us. I love it when they're talking about mental health, right? They never used to, a doctor dealing with you never used to, wonder about your mental health. You're trying to not die. And so what is your mental health? And so they're doing that, but they are also saying, hey, there are other types of treatment, but it's up to us as the patient or maybe the loved one to say, we're going to explore this. We're not just going to say, yes, sir, yes, ma'am, and do what they say. And so I love this, that you're kind of, in this to help people with all of this education.
Yes. And, this is such a critical piece, whether it's cancer, whether it's brain health, or it's menopause. It really, nobody is as vested in our health or our being as ourselves, right? Nobody can. And everybody is coming from their place of experience, their expertise, but we are the experts in ourselves, right? I am the expert in my body, my mind, how I want to be. And there is so much information out there that even for doctors, it is not possible to be on top of everything. They cannot keep up, especially doctors that are in the insurance model, that take insurance, and they are forced to do these 7 or 10-minute visits. It's not that that's what they want to do, but the system is such today that this is what is available. So because their days are so packed with short visits, and despite their best intentions, they are very busy, and they just don't have, often they don't have the time to be up to date on all the different things that are coming out. So I have all compassion and empathy for, my doctor colleagues who are just doing the regular thing. But it's really important for ourselves, for us to find out, to be cognizant when something is going on, and then know that, okay, I need to do some research. I need to find out. One of the things that I am finding is that 85% of menopausal women are not taking hormone replacement therapy. That is because either they don't know what are the benefits, how they can be helped, or that there is some incorrect information that they have, which circulates a lot on the internet, and with people who have not taken the care to educate themselves on the latest research. So it is either incomplete information, incorrect information, or the third thing is fear. Right? And the fear comes from incomplete or inaccurate information. It also comes from things like, sometimes women think, oh, you are medicalizing menopause. It's a natural stage of life.
It happens to everybody, or every woman.
To everybody, yes. And the thing is that what we need to understand, what happens in menopause, is what we need to really understand. It is a phase of life for sure. Every woman will go through it for sure. But what it technically is a long-term hormone deficiency. Okay. So let's say if somebody has hypothyroidism, that their thyroid is functioning suboptimally, it's not producing enough of the thyroid hormone, right? Then you would supplement with external hormone. You would take a medicine, this is the hormone, and because you need this on a daily basis for your body to function optimally, right? If somebody has diabetes and their body no longer produces insulin, well, then you need to take insulin extraneously. Like, you need to take insulin so that your body can function properly. It is the same thing with menopause. Your body stops producing estrogen and progesterone at menopause. That is the accurate, true definition of menopause, is that you are no longer producing estrogen and progesterone.
Your ovaries have gone, nope, we're done.
Right. And somehow we came up with this name of menopause, and that has now become kind of like a dirty word.
Right. There's
It-
definitely a stigma.
there is a stigma. The word has liability. It has baggage.
Right.
Certainly, women don't talk about it openly. And I have found that even amongst friends, women don't really talk about this unless there is an intention, there's a decision, let's talk about this. This is important to talk about.
Right.
Women are not generally talking about it. They might share something about hot flashes.
Yeah, they're going, and we go, oh, yeah, we did that too. And then you change the subject.
Exactly. Because a hot flash is so such an extreme physiological event that happens in a body, and it can happen at any time. And many times it'll happen when you're in the middle of a meeting.
Right.
You're in you're with people, or even if you're on Zoom, it's uncontrollable. You cannot control your reaction.
Right.
It's visible, right? So it's part of the culture, like, okay, a woman is having hot, but even then, the effort is to kind of move on or make light of that event. But you
uncomfortable giggles.
Yes. So what is happening is that your brain, that is it's a signal from the brain that, wait, your estrogen in the body is too low and you need to bring it up. So the hot flash isn't coming from the ovaries. It's not a sign that your reproductive function is over. It's a sign from your brain telling you, please provide estrogen to the body for global functioning. Okay. Because almost all cells in our body have receptors for estrogen, which means that every organ in our body works better with estrogen on board.
Okay.
If we don't have estrogen at a certain point, the first thing that takes a hit is our bones.
Right. And we get osteoporosis.
Right. So what happens is, even during perimenopause, when your periods become irregular, if you go 3 months without a period, your bones have taken a direct hit. Okay, so what's happening during perimenopause is that the ovaries are working really hard to put out the estrogen and progesterone in response to signals from the brain. Okay, because the brain always wants a certain amount of estrogen and progesterone in the body.
Right.
So sometimes women will get 2 periods in a month, and sometimes they'll go 3 months.
Yeah, kind of, it just, your body freaks out.
Right. So when you go 3 months without a period, then the rate of bone loss is fastest during that time.
Okay.
And after that, during menopause, the rate of bone loss can be up to 2% a year.
Wow.
That is a lot.
That
is
is
a lot of bone loss. And we know now that nothing is as efficient at preserving and building your bone strength as estrogen. Much more effective than bisphosphonates. Okay. And we also know that if you're taking calcium and vitamin D, but you're not on hormone replacement therapy, those supplements don't end up being so effective for your bones.
Right. They're not being absorbed correctly.
They are not able to function as much because the estrogen isn't on board to make the collagen and all the other things that you need for healthy bone functioning. Right. So if you don't have estrogen on board, then your body is going to produce less collagen.
Okay.
It's going to produce less elastin. So you get wrinkles, you get joint pains, you get muscle aches, and a whole lot of other things that happen in the body with the loss of these hormones. So it is critical for women to educate themselves on what to expect during this phase, and what to do to manage those symptoms so that your body is optimally prepared for all organs to function right. Because women have so much to do today. Like I am starting my business at the age of 50.
I love it.
So, but if I didn't have hormones on board, I could not do it.
Right. Because
because I went through my own phase of burnout. It was terrible. I couldn't do the simplest of things. Right. And I had to take time out of work to recuperate, even though I did bring hormones on board, because I had gone so long.
Right. It just took a while for your body to get kind of caught back up.
It took a while. And then, many women will have like heart palpitations or other symptoms, and they go to a cardiologist to see what's going on with them. And so what happens is, So if we just talk about, let's say, heart symptoms for a bit, right? What happens after menopause? Research has shown that right after menopause, the plaque in our arteries increases by 20% due to the loss of estrogen.
Okay.
So what estrogen does is it has, our blood vessels have estrogen receptors on them. And the estrogen keeps them supple.
Okay,
and
so it
able
helps
to
move
expand.
stuff through.
Yes,
Okay.
so blood circulation is good. Now, when the estrogen goes away, our blood vessels become stiff, and then plaque accumulates, and then we get poor circulation, and we begin to get heart palpitations.
Right. And the extremes would be stroke.
Exactly. More women die from strokes than men. More women die of heart disease. Okay, so women die of heart disease 7 times the rate they die of breast cancer.
Right. Because we have no idea what's actually happening, because it's different. It's not the right arm problem. It's, all and so, and we ignore it, right? We're muscling on through because we've got stuff we've got to do.
We've got stuff to do. And also, women don't know that heart disease is the biggest thing for women, biggest risk factor. So in every decade of a woman's life, starting with 40s, more women will die of heart disease than of cancer. Right. In every decade, 40s, 50s, 60s, and the number increases the older we get. And certainly, the symptoms of a heart attack in a woman are not the same as that in a man.
Right.
70% of women will not have chest pain. Right. And there are studies to show that so many women are sent home from a doctor's office or from a hospital mid-heart attack.
Right. Because they didn't have an EKG, so nobody caught that there was an issue.
So what's happening is, how these symptoms manifest for women is anxiety, nausea, gut symptoms. So it's really important to know what to look out for. And sometimes you might have to educate your doctor.
Right.
And I would love to talk about how to do that. First, how to educate yourself,
right,
and then how to educate your doctors, because it's not that doctors have poor intentions, but not everybody is educated on the latest in hormone therapy.
Right.
So it's important for us to know that.
Right.
And so you're right. Heart disease is a much big, and once you have heart disease, if you have heart disease, you have brain disease.
Right. Because you stopped the flow of
it's the
oxygen.
same cardiovascular system. It's the same blood vessels that are feeding your heart and different parts of your body and your brain.
Right.
Right. And in the brain, our blood vessels are smaller, finer.
Right.
And
so it's easier to damage them.
Exactly. And so that's part of the reason why during perimenopause and menopause, women begin to have brain fog. Memory loss, right? Insomnia, like these controls for temperature regulation, right? Hot flashes, night sweats, this is temperature regulation. It's in the brain, right? Our mood control is in the brain, right? Our symptoms like irritability, anxiety, depression, if this comes on during your 40s, is a good chance it's related to your hormones.
Well, and one of the things I tell people is your doctors or your medical care provider, maybe you prefer a nurse practitioner, or whatever, but folks, they're not psychic. And one of the worst things that people do is they will say, they'll say, "How you doing?" And our response is fine. And that can be anything from "I'm going to run a marathon tomorrow" to "I'm about to die," but we're just going to say "I'm fine." And so they, you need to tell them, "Hey, I have this, and this going on." And I don't think it's indigestion. I'm wondering about my heart health, all of those various things. And, and we have gotten used to the fact of, well, everybody goes through menopause, so I'm not going to complain about it. No, it's just like I tell people with their cancer treatments, you have to tell your doctors what's going on. It might not be that you have to have extreme nausea or all sorts of things, because things can be adjusted. But again, it's, we can't just assume they know what's going on. this is normal, this is typical, all of those things. No, in your 11 minutes that you've got with them, tell them, hey, that's what's happening.
There is this phrase that if you see something, say something.
Right.
So what I say is, if you notice something, say something.
Right.
If something is going on, say it to the right person.
Right.
But that means that you have to be educated. You need to know that these symptoms are not normal.
Right.
There is a better way for your health to serve you, for you to be able to do everything that you need to do. So I think what would be helpful is if perhaps I went over of common symptoms.
Okay, perfect.
That women might experience during this time. And then they can say like, okay, yes, I have these symptoms, and then I should do something about this.
Right.
And then perhaps we can talk about what kind of practitioner might help you. Right?
Perfect.
Or how to educate your practitioner. Or like
I love
what
it.
resources to read,
Right.
how to do the research for yourself, so you know what can be done about any of the symptoms that you're experiencing. Okay,
I love it.
Okay, so some of the symptoms that we know are like hot flashes and night sweats. We know. Okay, then there is difficulty getting to sleep and difficulty staying asleep. Either of those two. Right? Because estrogen dips at 3 a.m. in the morning. A lot of women wake up at that time, and then we have to figure what is going on, right?
And then our brain starts going, and that's it. We're done. We're up for the day.
Right. And then there are some skin symptoms, like you might feel skin is crawling or itching.
Okay.
Some people have itchy ears. Some women have itchy ears, like odd symptoms. They may have ringing in the ears during that time. Okay. They are more tired than usual.
Okay.
They have difficulty concentrating. Their memory is poor. They're more irritable. They're more anxious. They are experiencing more low moods. They have crying spells, headaches, frequent urination, leaking urine. This can be helped. This can be, we can do something about it. Pain or burning during urination, bladder infections, dry vagina, vaginal itching, painful sex, vaginal infections, reduced libido, okay, weight gain, bloating, breast tenderness, joint pains. So these are some of the symptoms, and the list is very long, but these are some of the symptoms I hear about commonly.
And it's not just because we're getting old.
It
is because we're aging, but it's not, it's like we said, it's,
it's not something to accept, like this is happening because I'm getting old and I just have to deal with it. I mean, since this is the power hour, right? This is for business women. And, a lot of women in their 40s and 50s run successful businesses. Some of them are starting new businesses during this time.
Like you were.
Like I am, right? So then what we need to just know is that these symptoms can be managed to the extent that you can be symptom free, from most of these symptoms, and you can have more energy, more clarity, more ability to deal with all the different things you need to deal with in your life. So if you speak to the right practitioner for you, they can help you, right? So in the United States, there is in North America, there is a North American Menopause Society. Okay.
Interesting. I had no idea.
Yes. So their website is menopause.org.
Okay.
So on their website, they have a list of menopause care certified practitioners. Okay. And this can be doctors or nurses.
And it's not just your primary care doctor, folks.
No, it's not. It's not. It could be somebody different. So these people are generally educated about hormone therapy. So you could look for somebody in your area. The problem is that in all of United States, there's only 2,000 certified members.
Right. Because again, there's a stigma. There's, all those various things.
There is a stigma. And, but the medical profession is beginning to come around. And the fact that there are 2,000 providers today, it's actually really great. There has been a significant increase in that number in the last 1 year. So we know that in the next few years, a lot more doctors will get certified. Okay. And they'll be able to provide you the care that you need and that you deserve.
Right.
Okay.
Right.
So that's one thing. The other thing is you might, even if somebody isn't certified, it doesn't mean that they are not literate on hormone replacement. you just need to ask around in your network and ask each other for somebody that has given you or somebody the care that they needed. So I think word of mouth, asking your friends and networks is really helpful to do that. The other way that you can educate yourself is I'll share a couple of books, these resources that. So one book that I have really liked is called Estrogen Matters. Okay. And the subtitle of this book is Why Taking Hormones in Menopause Can Improve Women's Well-Being and Lengthen Their Lives without raising the risk of breast cancer.
Right. Because that's the thing. People are like, oh, if I take this, then I get this.
Yes. So that association is incorrect and false. Let me just say that again. The association between breast cancer and hormones is false. It's incorrect information that has been around in our culture for way too long. The Women's Health Initiative, which came out with this information in 2002, has since walked that information back. But they haven't done it with the same fanfare with which they announced the false association. That's the problem.
Right.
So I think this book, and it has been written by an oncologist, a cancer doctor. Okay. And he, Dr. Avram Blooming, MD, and Dr. Carol Tavris, PhD. She's a psychologist. Wonderful, wonderful. This is an excellent book, very well researched, and has a lot of references. So that's one. So this is for the, this is for the novice and for the scientifically minded. So whichever one you take your pick. This is really great. And here is another book, which I really loved. It's called Sex, Lies, and Menopause.
I love that.
Okay. And this is about the shocking truth about synthetic hormones and the benefits of natural alternatives. When women are in their teens and 20s and 30s, they go on contraceptives without a thought.
Right.
Right.
Yeah. We're sexually active. We're on the pill.
Exactly.
That's basically it. Right.
And generally, the level of hormones in the pill is very high, and that's synthetic hormones, right? So we go on the pill because at that time, we don't know enough to ask the right kind of questions, right? So we end up being on the pill for decades.
Right.
And then women can have a lot of problems that they don't initially associate with the pill. They can be infertility, there can be other hormonal problems. And by the time they get to their 30s and 40s, they've kind of put two and two together and then said that, okay, the hormones did me harm, right? But what they don't realize that they were synthetic hormones and too high. When they get to menopause and they're like, I don't want to do hormones anymore. But you see how this hurts them.
Right. Because it's a different medicine.
Right. So the lack of complete and correct information hurts us, right? And also there's a lot of fear associated with stuff that we don't know.
Right.
The fear of breast cancer is so high, even though that association is wrong, that we don't realize that the positive effects of hormones are so many. And in fact, hormones are protective against breast cancer. Right. So before I talk about the other benefits of hormones, there's one more book that I want to talk about.
Okay.
And that is Dr. Louise Newson's book. And you can see how
Oh,
many
yes. Oh, my, you've got almost every page marked, it looks like.
And this is the definitive guide to the perimenopause and menopause. Okay. This is a doctor in the UK, and she's lovely. She has an amazing podcast, or maybe just a YouTube channel. She's pretty active on social media. So if you look her up, she has a lot of good information that she puts out there. And this is a very readable book. And most people will find probably this one to be the most helpful because she talks very friendly, easy way and helps you understand about what you need to know. Okay, so we've talked about a whole bunch of different things. What we've not talked about is the is brain health and the relationship with hormones.
Right.
I would love to do that for a second, if that's okay.
Yes. Yeah, because I think that's the other thing where, we don't even understand that there's a connection.
Yes, we don't understand. First of all, the whole world thinks that dementia is not preventable. I am here to say that dementia is preventable in a large number of cases. Okay. It has been shown by Dr. Dale Bredesen, who's a neurologist, that with a combination of diet, lifestyle, and investigating where your symptoms of dementia and Alzheimer's are coming from, investigating the various etiologies helps us understand how this disease has developed in your body. And if we understand how it has developed, it is possible for us to reverse it.
Right. Yeah.
Now,
it is not just you're getting it because your parent had it.
Right. So we have to keep in mind that we shouldn't wait to get a diagnosis of Alzheimer's before deciding to reverse it, before deciding to do something about it. Because the more physiological changes that have occurred in a body already, the harder it becomes to reverse them.
Right. It's kind of like a car.
Exactly.
It's easier to fix when you've got little things as opposed to, okay, I just blew the engine out.
Right. Exactly. So the sooner we act, the more benefit we see. And it's the same with hormones as well. If you are perimenopausal, that is the time to really consider, okay, what is the time for me to start hormone therapy, right? And the sooner after menopause you begin, the more benefit you have. Generally it's said that start within 10 years, but 10 years is too long a time from my perspective. I would say start as soon as you can, but work with a practitioner that can guide you properly, right? Okay, so now coming back to the brain. So Dr. Bredesen's whole protocol has revolved around Alzheimer's disease. And I have worked with patients that have Alzheimer's or those that are concerned about getting Alzheimer's because of family history, right? But my focus is really on preventing dementia in the first place. Now, the changes in the brain that ultimately lead to a diagnosis of dementia begin 20 to 30 years before the diagnosis happens. For many women, dementia, the changes in the brain begin at menopause. And why is that? Because we are losing our hormones.
Right.
Okay. Estrogen is a master regulator in women's bodies. We need this on board at all times. Okay. Progesterone, the other hormone, is a neurosteroid. Testosterone has many benefits other than just libido and reproductive functions. There are so many things that women need to know about. And the fact that, there is this researcher called Dr. Lisa Mosconi. She is in New York, and she has shown that women experience a 30% decline in brain energy at menopause. So she has done brain scans before and after menopause, and she can show a 30% decline in energy of the brain.
Wow.
Can you imagine that?
And 30% is a lot.
It's a huge number. And I just marvel at, really the resilience of women that we just keep going.
We figure out ways to adapt, right?
Somehow we keep going, but we do get burnt out. We do it at our own expense. Eventually we burn out. Eventually we may give up on our dream of that promotion or that business.
Right. Because we're just too tired to fight for it.
We are too exhausted.
If it takes more education or thing, you're like, nah, I'm just no.
Right. A lot of women will actually take early retirement, stop mid-career because they're just not able to cope anymore. And that's a loss to the whole world. So it's really important to know that estrogen and progesterone have an impact on your brain, on your heart, on your bones, on your sexual health, on your mental and emotional health, on your digestive health, pretty much every system of your body.
Right.
So it's really important to educate yourself on the benefits for you personally and what is the right time to start, what is the right dosage, and how this can help you in your personal life.
Right. Well, and the other things that you mentioned too, your diet, exercising, I mean, doing all of those things, we look at it and we go, yeah, whatever. But it is so important. And it's important for so many reasons. I mean, that's the thing. And I always tell people too, we need to know on a lot of this stuff, what our levels are, when you measure them long before there's a problem. I get lots of blood work every 3 weeks. I get lots of blood work and they're all, oh, you're high on this and low on this. I'm like, you understand, I'm always high on that and low on that. Maybe that's my normal. Because they, and they, sometimes they pay attention to me and sometimes they don't. But it's kind of, I saw something today that said, 98.6 is actually not the average body temperature. But we get used to that, right? And so we're told this is the number you're aiming for. And yeah, there are certainly ones like, I mean, insulin, those are one of the things, or your blood sugar level. They've got a pretty good handle on some of those, but still some highs and lows for you might be different. And so it's so important to know those things before we're going, is this high or is this low? And I don't know.
So I'm so glad you brought that up, because what happens is when you do labs,
Mm-hmm.
right, you will see your number,
Mm-hmm.
right? And then next to it, you see a range.
Right. The
Lab
average.
tells you, the
Uh-huh.
lab tells you the range.
Mm-hmm.
Now,
Right.
if you notice,
Mm-hmm.
if you take a look at that, that range
Mm-hmm.
is actually very wide.
Right. Oh
It's
yeah.
a
Depending
very,
on what
very
it
wide
is.
range.
Yeah. Mm-hmm.
And the thing to know is that for practitioners such as myself and in the
Mm-hmm.
functional medicine world, we know that there is an optimal range for
Mm-hmm.
each of those metrics,
Mm-hmm.
and that is a subset of the conventional range, which
Mm-hmm.
is very wide.
Right.
So depending on what's happening in your body, we'll
Mm-hmm.
know that because of your health history,
Mm-hmm.
your level for so and so metric tends to
Mm-hmm.
be at this level
Right.
and or something. But we also know what we want to encourage your body to move
Mm-hmm.
towards. It
Right.
may or may not be possible depending on your
Mm-hmm.
health history. Right. So
Right.
we want to know that if is your thyroid stimulating hormone, the
Mm-hmm.
TSH, the range is a certain number, like
Mm-hmm.
0.5 to like 5, which is
Mm-hmm.
a big range,
Mm-hmm.
but we know what is an optimal number.
Mm-hmm.
Okay. Or for your liver enzymes or
Mm-hmm.
anything else, there is the conventional range and there's the
Mm-hmm.
optimal range. So what you also said is like the diet and lifestyle being so important.
Mm-hmm.
Those are the foundations of health.
Right.
And a lot of us don't pay attention to diet and lifestyle and
Mm-hmm.
things like proper sleep,
Mm-hmm. Because
things
we're
like
busy,
stress
where
management.
fast food
Yes.
is the easier way to go, and all of those various things.
We learn the hard way.
Mm-hmm.
We don't, unfortunately, we just don't learn the easy way. We
Mm-hmm.
just don't, like, everybody knows that we should do a good job with what we eat.
Mm-hmm.
Everybody knows that we should get 7 to 9 hours of sleep every
Mm-hmm.
night. Everybody knows that there is something called a sleep hygiene. Put your
Mm-hmm.
screens away because the blue
Mm-hmm.
light
Mm-hmm.
keeps you from getting sleep.
Mm-hmm.
But how many of us actually do it?
Right. Mm-hmm.
We don't do it until something difficult happens,
Mm-hmm.
and then we realize that if we don't have our health,
Mm-hmm.
we have nothing.
Right. Right. And
It
it's so
takes,
easy to get things off that, and like you said, sometimes it's just maybe it's not even fixable. It goes far enough. And unfortunately then you have much bigger issues.
right, right. That's the whole thing. That's why I say, like, my passion is really in preventing chronic disease.
Mm-hmm.
Let's not wait to develop a
Right.
condition and then see what I need to
Mm-hmm.
do.
Mm-hmm.
Because ultimately, then that is way too high a price to
Mm-hmm.
pay.
Right.
Getting a disease and then being on a medication for the rest of your life is too high a price to pay.
Mm-hmm.
It's so much better to get the care that you need now,
Mm-hmm.
preventive care that you need now.
Mm-hmm.
Have yourself looked at top to
Mm-hmm.
bottom, take an inventory of your
Mm-hmm.
symptoms, speak to a knowledgeable provider,
Mm-hmm.
a practitioner, a doctor, or whoever you
Mm-hmm.
see, and get the care that you
Mm-hmm.
need and take care of yourself.
Right.
Eat
Right.
right,
Mm-hmm.
get enough sleep,
Mm-hmm.
manage your stress,
Mm-hmm.
mend your relationships with friends, your
Mm-hmm.
families. It's
Right.
so important.
Mm-hmm.
These are what we call foundations of
Mm-hmm.
health.
Mm-hmm.
If all of these things are in place,
Mm-hmm.
then you can take things like supplements or
Mm-hmm.
this, that, and the other. Like,
Right.
exercise, another very big thing.
Mm-hmm.
People do not prioritize that. It is so important to
Mm-hmm.
stay moving
Mm-hmm.
because that gives you good blood
Mm-hmm.
circulation. It moves your
Mm-hmm.
lymph. It builds your bone strength.
Mm-hmm.
So many things. So if you do all of these things that we call foundations of health,
Mm-hmm.
then you can do some testing to
Mm-hmm.
figure out where do you have things like risks to your metabolic health,
Mm-hmm.
your vascular
Right.
health. Are your genetics compromised?
Mm-hmm.
What are your genetics? Do
Mm-hmm.
you have the Alzheimer's gene? Do you
Mm-hmm.
need to, do you have any toxins that you're
Mm-hmm.
carrying in your body?
Right.
Mold toxins, chemical
Mm-hmm.
toxins, heavy metals. All of these things become etiologies for brain disease or other kinds of diseases.
Right.
So there are ways to look for where things are right now and put into place a plan that'll reverse the damage that has happened and keep further damage from happening.
Right.
And that way you can ensure that you are around for yourself, for your families, for your businesses, with the whole of you intact,
Right.
your brain and body intact.
Right. And again, it's about educating yourself and sometimes just nagging the living daylights out of your medical care providers. It's for the most part, the medical system is one that is reactive as opposed to proactive, right? I had full genetic screening, but not until after I was diagnosed with cancer. Now, the nice thing is it came back with nothing. I mean, I didn't have the BRCA gene. I didn't have any of the genes where they were concerned. But yeah, that they only would approve doing that, and it was not an inexpensive test. It's not something you're going to go, I'm just going to go have this today. But yeah, they would only approve it after there was a problem. Now, part of why I wanted to have it was specifically so that I would know, okay, I had this, I didn't have this, to tell other family members, right? Because we now have 2 people in my family who have breast cancer. So, and even just things like the body scans and all of those things that we only do after there's a problem. And that's a whole nother problem that we're not going to fix today. But it is, some of it is education. And I think a lot of times people just don't even know they can ask for those things.
See, this is the interesting thing. There are some insurance companies that will not cover a DEXA scan until you're 65, or you make a case for it that why you have a risk for osteoporosis and you should be checked early. Now, this means that you are not going to fix your, start taking blood pressure medication when the risk is high. Like, you're going to wait until the blood pressure is super high and then you're going to start taking medication. It's like, just doesn't make any sense. So I do think that the world is what it is because collectively over time, we have made decisions that have led us here, right? And so if we want to move to a different kind of world, collectively, we have to start making decisions that lead to a different kind of world. So what we can do today, there are a lot of things we can do proactively that do not require scans and things. First of all, just making a decision that you are going to be proactive about your health.
Right.
And then starting with small things like eating better, going to bed at a good time, managing stress, just doing those things will make a big difference. And then finding a compassionate practitioner who can help you put into place a plan that'll work for you. And then I did this for a patient recently myself. She's in her early 50s, and we had to make a case for why she should have a DEXA scan. And her MD did write a script for her for that. So sometimes, there are ways to work around. And you're right. If you ask for it, your insurance might cover it. So it's always good to know and advocate for yourself.
Right.
Super important to do that.
Yeah. We're, like you said, we're the ones who are in charge. And things that are just as simple as going for an annual physical, some things like that. But again, telling your doctor. I mean, this would have been a year ago or so, and it's very entertaining when I go in for my primary care. For my annual, because I don't take off my clothes. There's no reason. I have none of those things anymore that they check. But, I love my primary care doctor, who has actually said, I go in every 6 months. She said, to heck with this annual. She said, I want to see you every 6 months. And, and so I go in. But one of the times when I was in, how's it going? And so we chit chat and, all those things. And I said, well, I actually have this thing on my arm. And she took one look at it, and I was at the dermatologist the next week, and and it turned out to be a basal cell carcinoma. But it was just one of those where it was like, well, I have this little thing that bleeds every once in a while. And, she knew what it was. But again, how are you doing? Fine. No, we have to tell them what's going on.
Yeah, it's so invaluable when you have a medical care team that is a good fit for you.
Right.
There's nothing like it. Like when I was going through my treatment, even though my oncologist was kind of cautious about
Mm-hmm.
me being on hormones, she didn't say, don't do that. It
Mm-hmm.
was my surgeon who said that, okay, so you're picking quality of life over longevity. And I was like, you didn't really just say that, because that's not really true.
And actually, sometimes that might be your choice. That might be the decision you're
It
making.
might be the choice.
Mm-hmm.
Yes, quality of life is
Mm-hmm.
super important. And yes, I would
Mm-hmm.
pick that any day over
Right.
longevity for
Mm-hmm.
sure.
Mm-hmm.
But I do know the facts also. So I was like, this surgeon who comes very highly
Mm-hmm.
recommended didn't have the right information.
Right.
But my
Mm-hmm.
oncologist was wonderful.
Mm-hmm.
And I loved meeting with her.
Mm-hmm.
And she saw me as a
Mm-hmm.
person, not as a statistic.
Mm-hmm.
And it was really wonderful. So I agree that if you have a
Mm-hmm.
good primary care
Mm-hmm.
practitioner or a specialist that you
Mm-hmm.
see, there's nothing like it. It's
Mm-hmm.
wonderful. And they thrive also on good relationships with their patients,
Mm-hmm.
you know.
Right.
So once in a while, if they are not educated on hormones and
Mm-hmm.
things like that, you might take a book, one of the books that
Mm-hmm.
I've shared with you, and
Right.
just bring it for them.
Well, and because hopefully then they will take it, they will read, and then they'll be able to help other people. I mean, that's the thing.
Yeah.
Um, and
So I have heard on podcasts like doctors that are educated on hormones talking
mm-hmm.
about how to talk to doctors that are not educated about
Okay.
hormones. And they say the first thing is be nice,
Mm-hmm.
And I
Right.
was like,
Don't treat them like they're stupid or mean or rude or whatever.
be nice, be
Mm-hmm.
nice. They work very hard,
Mm-hmm.
and they probably just haven't had the time
Right.
to get caught up on
Mm-hmm.
some things.
Mm-hmm.
And there's a reason only 15% of menopausal women are on hormone replacement today.
Mm-hmm.
Because even if they want to ask about hormones, they
Mm-hmm.
might go to a doctor, and the doctor might just say, you don't really want that.
Yeah,
And they're
you don't need that.
yes,
Mm-hmm.
that's not a full discussion.
Mm-hmm.
You need a full, proper
Mm-hmm.
discussion. So
Right.
then, do your own research
Mm-hmm.
and bring the information to your
Mm-hmm.
doctor. And then they might not read it right away, but maybe somebody might read it
Mm-hmm.
right away. Who
Right.
knows? So it really
Right.
depends from person to person.
Mm-hmm. Mm-hmm.
But it's really important to team with your doctors.
Mm-hmm. Right. And again, find the ones that you want, that are going to help you the best. And it could be that you're going to go down a completely different path and do everything natural and things like that. I mentioned that I worked for an oncologist many, many years ago, and we had a patient one time who was Native American. And he came, he had his surgery, and I, honestly, it's been long enough ago, I don't remember what it was, but then we packaged up all of his records and sent them with him, and he took them back to his medicine man at his tribe.
Mm.
And I remember my oncologist doctor, he wished him well, and he said, whatever I can do. But he also said, and I, this was obviously it stuck with me. He said, 99% of this is in your head. If you think it's going to work, it will work. If you think it's not going to work, it's not going to work. And like I said, he was way ahead of his time. But it was very much, he really wanted to work with people to say, what do you want? And what's going to be best for you. And for some of them, they said, I don't want any treatment, back to
Yes.
the quality of life thing. And we certainly know of people who do 100% Eastern medicine who outlive all of us, right? So
Yes.
it's finding what works for you and then believing in it. I mean, that's the other hard part, is, it's not just, oh, okay, well, this sounds good, so I'm going to do this today. It really is, what is going to be best for you, and sticking to those. Telling your doctor, hey, I'm not going to have surgery, or I want this drug, or I don't want this drug. If they argue with you, then you need a different doctor.
Right. I'm so glad you shared that information about the oncologist you worked with all that while ago, because yes, that is so true. And my own radiation oncologist told me to read The Secret.
Mm-hmm.
And
Yeah.
I had not read it,
Mm-hmm. Mm-hmm.
and I was so
Mm-hmm.
surprised that she said, go home, read The
Mm-hmm.
Secret, and you'll be fine.
Right.
And I was like, okay.
Well, and that's why so many doctors are talking about things like meditation.
Mhm.
It seems kind of counterintuitive, but a gratitude journal. You're going through this, whatever it might be, and what are you grateful for? That comes back to the mental health aspects of all
Yes.
of this.
Yes, I can tell you from personal experience that when I live in gratitude, the world is a
Mm-hmm.
much better and happier
Mm-hmm.
place.
Right.
I am in a much happier and
Mm-hmm.
better place.
Mm-hmm.
It makes a world of
Right.
difference.
Yeah. All my doctors tell me, oh my God, you're always so happy. And I tell them, well, you just don't see me those other times, right? But it does, it makes a difference. I always, and we're not always that way. I mean, especially when we're pain, when we're scared, all of those things. But I think part of the gratitude is knowing they're trying to help you,
Yes.
And be grateful for that. And yeah, say thank you.
Yes. Yes, absolutely. Absolutely. Ultimately, I think we're all trying to do, like just take care of each other, take care of ourselves. Our challenges actually are not so different from person to person. We all just have a different version and size of the same problem. And so it's really just all of us on pretty much the same journey, just like, where we are at with it, from time to time. So I think just compassion for ourselves and for others, it's a big deal.
Right. Definitely. Yeah. Well, oh my gosh, we only have a couple minutes left, and we need to have this discussion again and in further detail, because there's so much more that I think we need to talk about. And obviously things change. I mean, that's kind of the cool thing too. So we'll have you on again. But how do people find you, and then how do they work with you? What are the services that you provide?
Sure. So people can find me on my website. It's arunamed.com. So it's Aruna, Aruna. Med is just MED, arunamed.com. And what I have done is, a lot of women don't know what to look out for symptoms. And I went through some of the symptoms today, but what I've done is I've created kind of like a symptom checker on my website.
Oh, perfect.
And so what they can do is go to arunamed.com/quiz.
Okay.
And then they can kind of take a quick quiz to see what is their score. And then that tells them, okay, where they are at with their perimenopause or menopause journey and what they need to do. So that's a great way to, check your symptoms. And that's also a great way to get in touch with me. You can schedule an appointment, a free discovery call with me. If you just have questions you want to run by me, you can send me a message through there. You can send me an email, a message, you can sign up for my newsletter, any of those things. But that's my hub, and that's where you can find me.
Perfect. I love it. And there's great resources there. I was looking through your website and so much great information. And it comes back to what we were saying at the very start. You have to educate yourselves. And so please do that. And again, it's arunamed.com. Well, Dr. Semby, this has been just absolutely delightful. Do you have any final thoughts that you want to leave everyone with?
Yes, I would say, I think I've been saying that, but this is what I want to say is menopause is a long-term hormone deficiency, and hormone replacement therapy, or HRT, is a human right. I just want to say that it's a human right. Every human that needs hormone replacement should get it, should have access to it, should have access to the information, should have access to a practitioner and access to the medications.
Perfect. I love it. Well, I am Deb Creer. I've been having a fascinating discussion with Dr. Manna Semby. And until next time, everyone have a great day.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.